17% of the possible learning disability health checks were carried out and completed in line with the enhanced service on offer to practices. The enhanced service requires practices to offer and carry out a health check. It isn't possible to identify from the payment return we get from the CQRS how many practices offered patients a health check that were not taken up. So we only get data on those that were actually taken up. In 2015-16, 3 practices have decided not to take up the offer of the enhanced service as of the 16th of November. Those are set out in Appendix 2 for you. It should be noticed that for some practices, most of the checks are carried out in quarters 3 and 4, and we only get reports at a quarterly interval, so monitoring in between quarters is harder to do. We have carried out a review against the enhanced service in East Anglia, and what that has highlighted is that there's a difference in the enhanced services between the old practice of East Anglia and Essex, and we believe that there may be some issues with the enhanced service that's operating in Essex at present, that the read codes that people are required to enter onto the system are not clearly enough explained, and practices are telling us that they're carrying out more health checks but not getting recognised for doing that. In previous years we've brought in additional capacity to commission that support for those who haven't signed up, and we're in the process at the moment of trying to do that again for the 3 practices not signed up this year. You should also note that for the 16-17 contracting round, we have indicated for practices that those who choose not to sign up will consider procuring an alternative service provider for those practices. You have a couple of appendices which showed you the uptake by quarter for practices in Thurrock, both for 14-15 and to date in 15-16, again on a quarterly checkpoint. You also then have the proposed action plan to try and address the issue to raise the number of health checks that are carried out. A couple of the dates have passed, so I can give you an update that the enhanced service and clarifying the read codes was done as indicated by the end of November, and the enhanced service should have been issued by close of play today. I've checked before leaving for here, so that should have gone out. The team are currently carrying out a series of calls to GP practices to reconfirm commitment to the enhanced service, also to confirm arrangements with the additional provider if they're not signed up or wish to withdraw. Also checking activity against reports from the CQRS where the providers, where the practices are telling us that they've done more health checks than seems to be indicated, and trying to get a better estimate of what year-end performance might look like. There are some other actions there detailed for you. So I'll give you a couple of highlights from the themes from the phone calls to practices so far. So practices are telling us that they carry out the health checks in quarter 4 when flu immunisation is complete. I think from the data we might say that that isn't to a level that is satisfactory and we need to do more. They're telling us they're doing the health checks, but the data doesn't support this. So it seems that they're not recording data correctly, so we need to do some work to train practices to get that correct. We have issues around staff training and recruitment that we'll try and address, and some additional activity this week. There's a teleconference to be heard on Thursday with the potential new provider for the practices not signed up this year, so we hope to have that resolved. We've looked to do some work on data quality so that we get a higher quality of data into the system and more accurate than reporting of the numbers that have actually had health checks. And we have appointed a project manager to take forward some work across the east of England, although on conversations with the CCG this afternoon, I'm going to look again at what we can do for Thurrock, given some history that I heard before the meeting had started about this being a longer term issue than perhaps I've outlined today, and we need to think again about how we get better service to the population. So if I pause there for any questions or not.
Thank you, Alistair. Any questions? Councillor Howell.
Thank you, Chair. Thank you very much for the report. I have to say, as a report, I find it really quite pleasing because I think it's entirely appropriate that we do name and shame people. But where do we go beyond shaming? Because The thing I find extremely concerning is we've got practices here that are on 0% for the checks they undertook in 14-15, and it actually appears that they've got the audacity to sign up to do exactly the same thing next year. And my understanding is that once they've signed up to do it, the funds are allocated to them, so it's not like we can encourage another provider to sweep in, because those funds are essentially been bedlocked by some of these people.
Yeah, I think that's the conversation that's been had with CCG and very briefly with other colleagues around the table today. Is what other models are there to ensure a greater uptake, because you're right, once the practices are signed up, resources are set aside for that, and we can't then use them for other means. So we're partway through a cycle, so this might be looking at improvements for 16-17, as well as trying to drive up for the practices that are not showing on the list of having carried out health checks so far, to do better for the population that they're serving, because there's a moral obligation here, isn't there, really? If you're signing up to deliver it and taking money from the public purse for doing so, you should deliver a service in return.
Surely they must be in breach of something. It seems impossible to me that some of these surgeries can have a reasonably substantial role of people with learning disabilities, do no checks last year, sign up to the same checks again. I mean, surely they must be in breach of something. Some good code of practice somewhere must say what they're doing isn't just morally wrong, because it's harming the wider service if we can't reallocate funds.
I agree with the point being made. I will take that back to look at what else can be done, Councillor Hull. It isn't an acceptable position, and I want to do something about it.
Councillor Key.
Thank you, Chair, and thank you for the report. Now, I'm sure a lot of questions you'll get tonight will be suggestions of things that you could do better, but I won't do that to you. What I really want to know is, A, what is the GP surgery's reasons as to why they're not hitting this number, and B, how quickly can your plan get us as close to 100%? And that's all I've got to ask for.
I think there'll be a number of issues why it's not taken up. Maybe we've got individuals who don't see, GPs who don't see this as the highest of priorities, busy workloads. So a number of reasons, I guess. It's, and how quickly would the plan get us there? To 100%, I think that will be a very tough ask, to be honest. I think the expectation on signing up to the enhanced service is a delivery at 70% of the population with a health check. So the plan will be looking to what can be done, or how close can we get by the end of March in this round. There's a separate conversation to be had, I think, with the CCG about what other models of delivery might there be that will give a better return for the resource than we're getting clearly from this programme.
Councillor Gupta.
Looking at your tables, I'm looking at the Barnford Clinic, a medical centre, and KK Mason and Dr. H. Mason, and the Thurrock Health Centre. They're all blacked out. And they are the ones which actually serve the people in my ward, you see. And I was just wondering why they are blacked out. And what happened to the patients? Let's just see.
I think it's those that have declined to provide it.
The patients, where the patients go? Patients of these doctors, where do they get the health checks?
We have a separate provider to provide the health checks for those practices that haven't signed up. Part of the work currently being done is phoning each practice where we have very poor activity to date to see if they still wish to be on the enhanced service, and if not, to make sure we've got a provider who can carry out the health checks.
And did you have any data how many actually patients have actually got the health checks done. Because here we can get some sort of figures where actually the patients have been checked or not checked. And about these 3 health surgeries, I was just wondering if you got the data that how many actually the patients have actually got the health checks in these 3 surgeries.
At the moment, the data shows none so far.
No.
The provider that we're looking to, there's a conference on Thursday of this week to get a new provider to provide those health checks. And there was a provider in place at the start of the year who's indicated that they want to withdraw from the service.
So we have no data. And we don't know whether they get the health checks.
No, that's the data you have in front of you. It's lifted from this the CQRS system. It's the calculating quality reporting service, which lifts information off the GP data systems. So it reports or lifts the information once a quarter. So if the coding of the people who've had a health check isn't correct, it won't recognise it when it lifts the data. And then later, if those corrections are made, it isn't picked up because the system doesn't do a look back. So we're looking to see if we can get the CQRS system later this year to do a retrospective view for quarters 1, 2 and 3. I'm not so optimistic that there's going to turn up a fantastic additional number of individuals with health checks. It's very poor delivery.
That's what I was going to say really, yeah.
Thank you, Councillor Gupta. I've got a lot of people want to ask questions. We're taking the order in which they were took my eye. Ian, please.
Thank you, Chair. Just wanted to pick up a couple of points regarding recoding and regarding uptake. So, the committee may be interested. So, in Southend last year, the coverage of LD health checks was 61%. In Cosford and Rochford, it was 51%. And as you said, in Thurrock, it was 17%. So, whilst uptake and recoding may be an issue, I find it hard to accept that the population of Thurrock is so different to the population of Southend or Goss Point and Rochford in terms of its demand for these health checks. I have a few questions. So the new provider, will that cover LD health checks for all practices or for only the 3 that have not signed up?
My understanding, Ian, is that will cover those who haven't signed up, so the 3 plus any of the others that aren't being telephoned by the team indicate they wish to withdraw from the enhanced service.
Okay. So your report highlights that I think they paid £116 and it's paid on a cost per case basis. So this is a historically poor prop in Thurrock, isn't it? So it was 17% last year, it was poor the year before that, 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 as far as I understand. So what is stopping NHS England from allocating some of the money in terms of cost per case to an alternative provider in the same way that we do for, say, flu influenza vaccination? So again, influenza vaccinations have to be offered to GPs on a cost per case basis, but we also commission alternative providers as patient choice, because we know that GPs will not hit the 100% coverage, and there's a level of flexibility.
That's the exact nub of the conversation that Mandy and I were having at 5:30 today about what else can be done to put the full value of resource for the health checks elsewhere in. So it isn't in this paper. There's a conversation with me that's only happened late this afternoon.
I just have to say to you with respect to this committee that given the level of health checks last year, given that this has been a historical problem year on year for the last 5 years, and given that we're just about to hit Q4 of this year, it just feels a bit complacent.
I'm sorry if that comes across to you that way. It isn't meant to. The report is very factual about the position for Thurrock, and I take on board the need to look differently at it. I'm willing to do that, but I've only had that information this afternoon.
Thank you. Kim.
was released for the CCG to commission a nurse, and we got up to 61%, I think it was, prior to that, and then last year it dropped back down. And last year, every year we have a working party. Every year in HS England have a new project manager. Every year it's going to be sold, and every year it isn't, and we're back here again. Today we've had news that again there's going to be another project manager running another workshop, and I'm sorry but I'm workshopped out. Somebody now has to actually do something. We're at a point we can't just keep talking about it. We've got people in our community that are dying of cancers that have been unrecognised. We've got people in our LD communities having strokes because nobody's realised they've got high blood pressure. We've done everything we were asked to do year on year. So as a community, not just us, but groups in the community, one year we wrote letters to the doctors on behalf of the LD residents asking them, please can I have my health check, I'd like to make an appointment. Nothing. We done peer-to-peer work where we've got people taken along and were asked, can I book my health check? No, we're not doing them. And they had signed up. They were doctors that had actually signed up and said they were going to deliver them. Last year we had, the person running the project last year said it was because people in the community failed to realise how important their health checks were and were not going for them. And we said, but they can't get them. No, that's what it is. So at the cost of the community, the voluntary sector, we ran actual workshops for people to show them, to take away any kind of fear that they may have. We had nurses, we had mini health checks, we done a whole lot, and still they were told no. And here we are in November, and only now we're looking at where can we find a solution. Because year on year they say they're not going to do it. So at what point do you think, well actually they might actually do it this year? They're not going to. This is just a ridiculous way of delivering, or failing to deliver something. And really somebody has to make a stand on this and say no more workshops, no more discussions, we need a solution.
Okay, thank you, Kim. Mandy.
Thank you, Chair. I was actually going back to Councillor Gupta's point about those practices that have said they won't do it. Now, actually, those are the practices. We would like more practices, to be honest, and actually say we don't want to do it. And in fact, if all of the practices said we don't want to do it, and the money was there to commission as and I'm not going to go over what my colleagues have said, but that would be the ideal solution. We've got one or two practices who obviously are showing a high commitment to this, but I think where there isn't that commitment, we would much rather that they said, no, we don't want to do it, and then it would be much easier. Because the issue about counting, the system that the GPs use to upload their data, as Alistair has said, is notorious. It is, you just don't know where the accuracy is. The year we commissioned North East London Foundation Trust to deliver, we got 61%. We got paper, or we got a trail which identified patients, and we were able to see quite easily, not going through some strange database. So actually those who have said no are in a better position, I think is the point I'm trying to make.
I think I'd just like to make a point at this stage here. Given everything that's been said, and given the amount of practices that are not carrying out the service, do we not have the sanction to say, well, I'm sorry, but even if you apply to it, you're not having it. There's all the money you could save by saying, well, you've not provided the service, you're not going to be able to reapply to do it, and that will give you instantly the money for a large chunk of money to re-provide the service yourself. I mean, obviously, you've got a few there that are actually doing okay, and they can remain as providers, surely.
I think that's a fair point, Chairman, and I think the commitment, Kim, that I give to you personally is I'm going to go away and rethink this approach, because if there is a model that delivers 61% across the board, then what I don't know to say to you today is why we aren't following it now, because it seems to me to be a bit of a no-brainer to revisit that. So I will do that.
You want to Councillor Howland?
Thank you, Chair. Ian's point about perhaps trying to run them essentially out of business by re-providing elsewhere seems like a very sensible way forward, but should the people who are failing to hit targets and are reapplied, I mean, that is quite disgraceful. Now, all these GPs will have patient liaison groups, so on and so forth, etc. I mean, we've got a UKIP chair, a Labour cabinet member, a Tory shadow cabinet member. Between the three of us, there would be some sort of public campaign that we could mount, and we could put the proposition in front of the public and just explain that there is a reason that the disability health checks can't go ahead at the moment, because some of these individuals are bogarting money, and there are solutions like Ian's that could probably be offered that we can't, as long as, because what I'm gathering we're hearing is we don't actually have a formal mechanism to force the issue and force it to take away from them. Surely there's public pressure we can mount on these surgeries, and I don't want to pick anyone out because that would be unfair, but could I ask that Deshpande AM and Partner, is that not the chair at CCG? That's on 0%?
That is the chair, yeah.
I don't want to pick anyone out to be unfair because no one's here to defend themselves, but I'd quite happily stand with colleagues and explain the issue to the public. Which is there are probably solutions that we can go down, but we can't go down if these people refuse to let go of the purse strings. Unless we've got a full mechanism.
You may.
Just a point of clarification. So we actually can, as far as I understand, so the money doesn't sit with the practices, the money sits with NHS England.
Yeah.
So every time a practice undertakes a health check, they get a little bit of the money, 100 and whatever it is.
£116, yeah.
So given that 17% of the health checks were done last year, only 17% of the budget was spent, and the rest of that budget sits with NHS England. So there will be nothing to stop NHS England
To hire
commissioning an alternative provider now. Just on the historical trend, we know that practices don't perform 100%, they're likely to perform a much lower.
Thank you for that clarity. So I think I'll get back to the point earlier. We heard today that a model that delivered 61% of health checks across Thurrock. We need to revisit that and not perpetuate a model that clearly doesn't deliver.
Try not to go old ground because I think we've been through this at the Health and Wellbeing Board so many times, and I still cannot understand why people find it hard. Everyone says it's hard to do the health checks, then keep re-signing and re-signing and re-signing every year. So I almost applaud the three practices that have opted out, because I think that's actually the best way forward. I've just done a calculation in terms of 770 patient buy. It's about £90,000 that they actually set aside for this service, and you could most probably employ two elderly specialist nurses through that and go around and doing it properly. Okay, there's issues about accessing the information from the GPs, but I know in the past there's been a problem about people releasing information. But I think we want to try and find a solution to this, because there was an enormous amount of work put in through the Learning Disability Partnership Board. We did the health passports, we did the health action plans, we commissioned with Health Watch and Thurrock Lifestyle Solutions. We set up, we put advocacy in place. We had all the, if you like, the ingredients in place. And I think what we should actually recommend is to all practices opt out. Don't sign up for it. Don't go for it. And I don't know what powers, I don't understand why NHS England keeps offering the service. I think NHS England should come from the other way round and say our intention is to assume that you will be opting out. So you have to actually positively opt in. So we assume that everyone will be opting out next year, and the service should be commissioned by the CCG, because I think they're better placed to do it at a local level. So I think from trying to think of a way forward, because clearly this isn't working as it is at the moment.
Thank you, Roger.
My point's been covered, but I just want to come back on Roger's, that that's a good solution, but that leaves us another year down the line, doesn't it? And you've got to wonder how many problems can crop up in a year. And it doesn't.
That's true.
It doesn't take too long to suffer from cancer, does it? And for it to take your life over. And I think we need answers soon. And I think February isn't a long time away. It's certainly a lot closer than next year is. And I think the good people of Thurrock need an answer to this. Is there anything we can do as a committee? Is there anyone we can lobby? Is there anyone we can is there anywhere where the buck stops? You know, what can we do as a group of councillors here to say this just doesn't wash with us? What can we do?
Thank you, Councillor Key. I think for this committee, the buck stops with me, and I give you the commitment to go and review this, because this clearly isn't delivering for the people of Thurrock. I've heard a greater history about the service or the approach not delivering. Some very interesting information about the way it did deliver. I don't know why that stopped or reverted back to this, but I give you a personal commitment to go and review it and not to leave it until the start of the next financial year.
Thank you, Chair. I think it would be beneficial if perhaps you or one of your colleagues were able to come to the Disability Partnership Board, which is actually taking place later this month on the 17th of December, and then meets again in March to provide the service users and the officers and the members of the community that sit around that table and do a lot of work on the ground, an actual action plan in a positive way forward, so that we can start to feel more positive about what's going to happen in the future for the people that we support.
Of course. Barbara.
What can I say, Chair? Once again, unfair, unjust, unacceptable for the people of Thurrock. The inequalities just go on and on. I'd like to pick up on a point that Councillor Howden made around we could get some kind of lobby group. I don't know if you're aware, Councillor Howden, that we have been lobbying along with Health Watch now for myself for 4 years, and I know Kim's been doing it a lot longer than that. It's totally unacceptable, forgive me for saying, Alistair, 5:30 this evening that you were given some information and that you're going to take it up from here. It isn't acceptable for this to be going on year on year on year without a resolution coming out of it. It's totally unacceptable. What I can't understand is if I performed at 0, my residents would certainly get shot of me. Okay, if Roger performed at 0, he certainly wouldn't get a job the following year. And yet we're giving people £90,000 worth of money year on year to perform at 0, albeit that some of that is performing. It's unacceptable, and we are not prepared in Thurrock to put up with this nonsense any longer. We want a resolution for our people of Thurrock. We want equality with the rest of Essex and the rest of the country.
Well said.
Thanks, Barbara. Anybody else got any further points?
Can I just say, who has got the, it seems to me there is the Health England which has got the final authority. Has the CCG got any power to do, because I think you're right about that for the last 5-6 years we've been struggling with this issue, and obviously it seems to me that people with disabilities haven't got much say, and they can't put that sort of pressure. But the people here and the people in our board are talking about that for the last 4 or 5 years. So who has got the ultimate responsibility for making the decision? I'm just asking you. Who's got the ultimate power? If CCG hasn't got the power.
The authority for making the decision would be with NHS England. So as the responsible locality director then sits with me. I've given my commitment several times today, accepting that this isn't good enough performance. Some very good suggestions from councillors and from other members around the table. I want to take it away and get it right, because I don't want to be back here in February having a service that isn't delivering for the population of Thurrock.
So perhaps the chair can actually, we can say, propose the chair will write a letter on behalf of this committee to the to Health England, and I pointed out that how strong views we have got as councillors and others who are on this committee and telling people up there, and bring that out, that we need some urgent action. People can't wait for years and years and years for that. And I just propose, if we all agree, Chair, that the Chair writes a letter on behalf of the committee to Health England.
Yeah, I'll take that on board, and I think that's something that we can do, certainly.
Yeah.
And I think that's the very least that we ought to be doing, to be honest. I mean, as everybody said there already, as you know, Esther, and I think this has been going on for years and years, and we've had continual commitments for improvements, and we've received none. And I think from listening to everybody around the table, I think Thurrock's done its bit to get involved with the process. It's engaged in all the programmes that's been put forward by an SGS England Trust to get engaged with. So we've done all of that, and still the improvement hasn't come. So I think it is incumbent on yourself now to go away and come back in February. I'd like it to be January, but we're a bit chopped of January, unfortunately. But I want to see a firm action plan, and no, nothing wishy-washy. Let's have some actual firm commitments, a firm plan of action that we can look at and we can see if it's going to make a change and go in the right direction. Is that something you can commit to?
Yes, Chair, I can commit to doing that for you and for the population. So.
Excellent, that's exactly what I wanted to hear. So, what the panel in agreement with that, so we come back to this in February? Okay, thank you. Right, in that case, we'll go back to the recommendation, which is just to basically note the report with the added recommendation that we'll be giving this back to the committee in February.